Every day, millions wake up to the same familiar pain, a stiff back, aching joints, and the quiet fear that their mobility is slipping away. For decades, conventional medicine has offered temporary relief, steroid injections, pain pills, even surgery. But what if there was a way to truly heal, to regenerate the very tissues that have broken down with time? Today, we explore the revolutionary world of stem cell technology, a science that's rewriting the future of joint and spinal care, one cell at a time. Before we get too deep into this topic, hit that like button and subscribe to the channel. This will help bring the truth about health and healing to the thousands of people who need to hear this message. Now back to the episode. Joint and back pain are not just physical burdens. They steal independence, affect sleep, limit movement, and dampen the joy of living. Most conventional approaches, corticosteroid injections, radiofrequency ablation, or surgery, don't fix the root cause. Steroids suppress inflammation temporarily, but they accelerate cartilage breakdown. Radiofrequency ablation burns the pain nerves, but it also halts the body's natural signals for repair. And surgery, while sometimes necessary, often fails to restore natural function. The truth is, these methods treat symptoms, not the source. They silence the alarm bell without addressing why the fire started in the first place. Stem cell therapy represents a paradigm shift, not in symptom control, but in cellular repair and regeneration. Stem cells are the body's master builders, cells that can differentiate into muscle, cartilage, ligament, tendon, and even neural tissue. When injected into damaged areas, such as an arthritic knee, a degenerated spinal disc, or a torn rotator cuff, these cells can stimulate biological repair, not just numb the pain. The science is extraordinary. Once placed in a damaged environment, stem cells release a cascade of growth factors, exosomes, and cytokines, biochemical signals that awaken the body's own repair machinery. This is not about suppressing inflammation. It's about directing it, guiding the body back to balance, and restoring what time and injury have taken away. The story of stem cells began decades ago. In the 1960s, researchers discovered primitive cells in bone marrow capable of producing all blood components, but the world truly began to understand their potential when pioneers like Dr. Bruce Lipton began exploring how cellular environments could influence genetic expression, a concept that would evolve into epigenetics. Dr. Lipton's groundbreaking work revealed that cells are not prisoners of their DNA. They respond dynamically to their surroundings, chemistry, hormones, and even emotional energy. His insights opened the door to regenerative medicine, the idea that if we can change a cell's environment, we can change its destiny. And that's precisely what stem cell therapy does. It changes the environment of a damaged joint or disc, triggering regeneration instead of degeneration. There are two primary sources of stem cells used in modern regenerative medicine: autologous and donor-derived. Autologous stem cells come from the patient's own body, typically from bone marrow or adipose fat tissue. Bone marrow-derived stem cells contain mesenchymal stem cells, MSCs, capable of forming cartilage and bone. Adipose-derived stem cells are rich in regenerative cytokines and growth factors, often used in soft tissue repair. These are harvested, processed, and injected back into the patient, completely biocompatible with virtually no immune reaction. Then, there are donor-derived stem cells, obtained from highly screened sources such as umbilical cord blood, placental tissue, or allograft products. Cord blood stem cells are young and potent, filled with exosomes and signaling molecules. Placental and amniotic tissue contain natural anti-inflammatory compounds and regenerative peptides. Lyophilized or allograft stem cell products are preserved formulations used when a patient's own cells are insufficient or aging. Each type has its purpose, and a skilled, certified regenerative physician determines the best match for each patient's unique condition. At the molecular level, stem cells are biochemical miracles. Once introduced into a degenerated joint or disc, they secrete exosomes, tiny vesicles packed with microRNAs, peptides, and enzymes that activate dormant healing pathways. They stimulate chondrocyte proliferation for cartilage regeneration, fibroblast activity for ligament repair, and angiogenesis, the formation of new blood vessels, to restore circulation to injured tissue. In degenerative disc disease, stem cells can restore hydration and matrix integrity to the nucleus pulposus, the soft center of the disc that cushions the spine. This is healing at the quantum level of biology, not replacing parts, but reprogramming the system back to health. Conventional medicine is based on intervention, cutting, freezing, or suppressing symptoms. But regenerative medicine is based on restoration. Corticosteroids can calm pain, but weaken tissue. Surgery can remove damage, but rarely regenerates what's lost. Stem cells, on the other hand, address the root cause, cellular degeneration. They promote long-term recovery by repairing and rebuilding tissue rather than simply numbing pain signals. In clinical practice, many patients who were once told surgery was their only option. Knee replacements, spinal fusions, rotator cuff repairs are now avoiding those procedures through stem cell therapy. Because stem cell medicine is still evolving, it's vital to find a physician certified in regenerative therapies. Proper harvesting, processing, and injection techniques make all the difference in outcomes. True regenerative specialists understand not only the cellular science, but also the anatomy, imaging, and precision needed to guide these cells to their target. A certified doctor ensures safety, potency, and results that last. We are witnessing a new era in medicine, one that doesn't just manage pain, but reverses degeneration, one that doesn't view aging as inevitable, but as a process that can be rebalanced at the cellular level. Stem cell therapy is more than a treatment, it's a reminder that the human body was designed to heal itself, and with the right tools, it can. If you or someone you love suffers from chronic joint or back pain, learn about regenerative medicine, ask the deeper questions, seek certified professionals who practice at the intersection of science and healing, because sometimes the future of medicine isn't found in surgery, it's found within our own cells. If you found this information helpful, please like this video and subscribe to the channel. Leave me a comment as to how back pain or joint pain has affected your life. For a detailed look at regenerative medicine and stem cell technology, please check out my book, The Pain Solution. You can purchase the book through my website, drvictoriamunoz.com. The link is in the description below. For more information about our clinic, please also go to drvictoriamunoz.com or see link in description below. We have helped thousands of people regain their health and vitality, and we can help you. Join us next time for another deep dive into the complex world of medical science. I am Dr. Victoria Munoz. Until next time, take care.